As I indicated at the start, the young person who's infected is still in critical care, so we are not able to talk to them directly about where the exposure might have happened. Their family and friends have been incredibly generous with their time and, of course, anxious themselves to try to understand how this happened. But as I also mentioned the first time we talked a couple of weeks ago, in the absence of being able to talk directly to this teen, we may not ever know for certain exactly where they were exposed and where it came from. This is not unheard of. In the US, there have been cases identified last year in Missouri where, again, there was no contact identified, there was no source identified. And as I mentioned most recently, this child in California. So our investigation, our detailed public health investigation, is closed for now unless anything new arises. And I am very confident that there are no additional cases out there right now, but we still need to be careful and we need to watch and think about how do we prevent this from happening to anybody else. As I mentioned, this virus is moving around the world in migratory waterfowl. So that's ducks and geese that migrate north in the spring and south in the fall. And we're along what's called the Pacific Flyway here in British Columbia, particularly the lower mainland, but it covers the entire province. And we know that this is the highest risk period of time, and in particularly November and into early December, when the ducks and geese are coming down into this area of town, or of the province. And since 2022, this virus, H5N1, has been found and has been causing outbreaks in backyard flocks, in poultry particularly, and we've detected it in wild birds. And the very first one that was detected was actually a raptor, an eagle in Vancouver. And when an eagle is sick, people tend to notice them, and it was tested and it had H5. So this is the 6th season that we've had these migratory waterfowl leading to outbreaks. So what can we do? Critically, it is especially this time of year, avoid sick animals and birds, and you can report wild birds. We have numbers and it's on all of the information that I can provide to you. But we also want to make sure we keep pets away from birds, but also from ponds and areas that they might want to go into right now, because we know that ponds that have ducks and geese in them right now can have virus in the water that lasts for some time because of the droppings and the feces from the birds. Don't handle ducks or geese or poultry at this point in time in places like petting zoos during these high-risk periods. And I understand that ducks and geese don't like to be handled anyway, but we do know that it's some of these farm visits where chickens are handled by young people. This is not the time to do that because we know there's a risk from these migratory birds. If an area with bird droppings, if you're in an area with bird droppings, or if you're handling pets that have been outside, ensuring that you wash your hands frequently after touching pets or any of the areas. Other things that are important for us to do, get the updated influenza vaccine. This year, the vaccine has H5N1 and H5N1 in it. And those are human influenza viruses that we're seeing circulate. We're starting to see a little bit of an uptick of influenza causing illness now. And as we head into the holiday period, we expect we'll see more. And though the H5N1 is different from the avian version of the H5N1, there is some research that indicates that we may have some protection by getting that vaccine with the N component that is the same. We also want to get our updated COVID vaccines and make sure that we're doing the healthy habits that keep us all safe. Things like washing our hands, covering our mouth when we cough, staying away from others when we're sick. We want to make sure that we're not sick, so that as we head into the holidays, we can enjoy them with our family and friends without worrying. I also want to just make a comment about, we are very aware of the pandemic potential of avian H5N1. the more humans that are exposed to this virus and the more other animals, particularly other mammals, and we worry a lot about pigs, as I mentioned last time, there's an increased risk that the virus might change and become more easily transmitted from person to person, or that somebody can be infected with both of the viruses at the same time. So far, this H5N1 virus, the avian flu virus, does not seem to transmit to people very well. And we know that because we've had, as I mentioned, over 54 now outbreaks in poultry farms where their poultry workers and the people who are euthanizing the birds that are infected have been exposed to high doses, and they do wear personal protective equipment, but we have not seen any infections here in British Columbia this year. And a very small number, despite large numbers of people being exposed in the United States to birds and also to dairy cows. So those are things that are reassuring. And this virus has, as I mentioned, been around for several years now. But this case reminds us that there is always that risk, and we need to be vigilant for that, and we need to take those measures that protect us individually and as a community. And from my perspective in public health, we will maintain our important and robust surveillance that picked up this case in the first place, and ensure that we have both our wastewater surveillance and the surveillance that we have in healthcare settings to be able to detect these early.